Adductor channel. Now you understand the adductor, hunters or subsartorial canal. So commonly we call it as adductor canal, but it has different name like hunter canal, subsartorial canal. Why? Let us find out. So first, what is the definition of this? This is also called as subsartorial canal or hunter canal. Why hunter canal? Because it was found by scientist John Hunter, who was an anatomist and surgeon at London. So Hunter operation for the treatment of popliteal aneurysm by ligating the femoral artery in adductor canal is a landmark in history of vascular surgery. So whenever he is doing a surgery in the popliteal canal, then he found that there is another canal called adductor canal whenever he is surgery doing a surgery on femoral artery. So adductor canal is an intermuscular space which is situated on the medial side of middle 1/3 of thigh. So on the middle, actually this is a femoral triangle, right? This is adductor longus, this is the sartorius muscle. So here in the middle of the sartorius muscle, here you have the adductor canal which is deep to the sartorius. So deep to sartorius you have a canal here that is called as adductor canal. Okay, so if you see the extent, this canal is extending from apex of femoral triangle. This is the apex, right? This is the base. So from the apex of femoral triangle above to the tendinous opening in the adductor magnus below. So here will be the tendinous opening of adductor magnus below. So till here this canal is extending, and the shape the canal is triangular in cross section. So here you can see the shape of the canal. This is triangular. Cross section means if you cut the leg like this. Okay, so if you cut the legs like this, and if you're seeing from above, then it looks like this. So you can see this is a femur bone. Here you have the adductor canal. So let us find out what are the boundaries of this adductor canal. So anterior to the adductor canal, posterior and medial walls. So first we should see what are those. So this anterior, posterior, this is femur bone is here, means this is medial, this is lateral. Okay, so first let us see the anterior wall, which is formed by vastus medialis. So anterior wall is formed by vastus medialis. You can see here this is the anterior wall, and the posterior wall or floor is formed by adductor longus. So this is the posterior wall, adductor longus. Okay, and adductor magnus below. Actually the posterior wall is formed by adductor longus above and adductor longus below. Okay, once again let us revise. Anterior wall is formed by our vastus medialis. Posterior wall is formed above by adductor longus, below by adductor magnus. Okay, above adductor longus, below magnus. And the medial wall or roof is formed by strong fibrous membrane joining anterior and posterior walls. So anterior and posterior wall, you can see this is the fibrous roof, this is the medial side, this is the lateral side. So medial side, the anterior and posterior walls are connected by the fibrous roof. Okay, and the roof is overlapped by sartorius muscle. You can see this is the sartorius muscle which is overlapping this roof. Next, coming to subsatorial plexus of nerves. What are these nerves? Let us find out. These are lying on fibrous roof of canal under cover of sartorius. This is called as subsatorial plexus. Okay, these are the plexus formed by branches from medial cutaneous nerve of thigh, saphenous nerve, anterior division of obturator nerve, and they supply overlying fascia lata and neighboring skin. So this is called as subsartorial because it is means below the sartorius muscle, hence it is called subsartorial plexus. Remember what are the nerves which are participating here. So mainly the medial cutaneous nerve of thigh, the saphenous nerve, anterior division of obturator nerve, all are supplying this one, and they supply the overlying fascia lata and neighboring skin. So now coming to the content. So what are present in this adductor canal? So the first one you have the femoral artery. This one red color is femoral artery which enters the canal at the apex of the femoral triangle. Within the canal it gives muscular branches and descending genicular branch. The descending genicular artery is the last branch of femoral artery arising just above hiatus magnus. So just above hiatus magnus it forms. So the femoral artery divides into superficial saphenous branch which comprises saphenous nerve and a deep muscular branch which enters the vastus medialis and also reaches the knee. So once again let us revise about the femoral artery. So the content of this adductor canal, first one is femoral artery. Femoral artery enters the canal at the apex of the femoral triangle. With the canal it gives muscular branch and descending genicular branch. Okay, and the descending genicular artery is last branch of femoral artery, which is arising just above hiatus magnus, and it divides into superficial and saphenous branch, which accompany the saphenous nerve and deep muscular branch, enters the vastus medialis, reaches the knee. Next, coming to the femoral vein. Next to artery of femoral vein, this lies posterior to femoral artery in upper part and lateral to the artery in the lower part of the canal. So the next content is saphenous nerve. So we also have the saphenous nerve here, this one. Saphenous nerve crosses the femoral artery anteriorly and from lateral to medial side. It leaves the canal with saphenous artery but piercing the fibrous roof. Next you have the nerve to vastus medialis. This is lateral to the femoral artery, enters the vastus medialis in upper part of the canal. Next there are two divisions of obturator nerves inside only. The anterior division emerges at the lower border of adductor magnus. So you can see below adductor longus you will have the adductor magnus. So there are two division of obturator nerve into anterior division, which is at the lower border of adductor longus and gives branches to subsatorial plexus and ends by supplying femoral artery. The posterior division of obturator nerve runs on anterior surface of adductor magnus and accompanies the femoral and popliteal arteries, ends by supplying the knee joint. So the clinical anatomy which is related to this adductor canal or subsartorial canal is the femoral artery is exposed in adductor canal for various surgical procedure. After ligature of femoral artery in adductor canal, collateral circulation is established through anastomosis between descending branch of lateral circumflex femoral and descending genicular artery. So between the fourth perforating artery, the muscular branches of popliteal artery. So there are two anastomosis. One is between the descending branch of lateral circumflex femoral with the descending genicular branch of femoral artery. Another one is the four perforating arteries with the muscular branches of popliteal artery. So this is all about the adductor hunters or subsartorial canal. Once we can check out this diagram for the contents of adductor canal, that is the femoral vein. Next comes the femoral artery. The femoral artery gives a branch called descending genicular artery, and you can also see the saphenous nerve, and this is the saphenous artery and the muscular artery. This is the posterior division of obturator nerve. This is the femoral vein. These both are the muscular branches of femoral artery, and this is the nerve to vastus medialis. This is the anterior and posterior division of obturator nerve. As we discussed just now the topic, you can correlate the topic with this diagram.